In this video, you will learn the essential steps to get your customer or patient walking on their iWALK crutch. In it, we will cover how to determine who should use the iWALK, what adjustments are available, and how and when to use them, how to fit the iWALK for optimum efficiency, how to teach the user to walk on their iWALK. Before we get started, the iWALK should be fully assembled per our video instructions. Confirm that the straps are removed and that the thigh supports are in the number 6 position. Qualifications for use. The iWALK crutch works for most people, but it's not for everyone. Your first responsibility as a fitter is to determine if your patient meets the requirements for use of the iWALK crutch. Start with these physical abilities tests. These two tests can quickly qualify or disqualify your patient. Test 1. Before their injury, could your patient fluidly go up and down a flight of stairs at normal walking pace without using the handrail for balance? Test 2. Can the patient balance on their good foot for at least 30 seconds? If your patient can pass both tests, then they have the physical ability to use the iWALK crutch. If they cannot pass both tests, then they are not likely to adapt to the iWALK crutch and would be better off with a different mobility device. Here are the rest of the physical requirements for use. The uninjured leg is fully functional. The injury is below the knee. Injured leg can bend at the knee at least 90 degrees. Patient is not significantly overweight. If your patient does not pass all of these requirements, then the iWALK crutch will not work for them. Capacities and adjustment range. To ensure the success and safety of your patient, it's essential that you stay within the capacities and adjustment range of the iWALK crutch. Height. Most people know their height, so this is a good place to start. The iWALK works for most people between 4'10" and 6 feet 6 inches. But because leg length proportions can vary considerably, there are some limitations. If you're at either the short end of the spectrum, from 4'10" to 5'2", or at the tall end from 6'2" to 6'6", there's a 3 to 5% chance that the iWALK will not fit. Weight. The patient must be no more than 275 pounds. Upper thigh circumference at the top of the leg, minimum is 15.5 inches, maximum is 28 inches. Age limits. Using age as a qualification criteria is way too broad. The mobility of seniors varies significantly from person to person. So with the elderly, use the exact same qualification criteria you use for the non-elderly. High body mass index or obesity. The iWALK crutch recruits the upper thigh to help stabilize the device, so a high body mass index results in more uncontrolled movement of the device. This reduces stability and control, which makes it harder for the patient to adapt. Diabetics. Type 2 diabetes is often accompanied by obesity and lower limb neuropathy. If your patient has these conditions, they are unlikely to adapt to the iWALK crutch. Artificial joints. Hip, knee, or ankle replacements can make it more difficult or impossible for your patient to adapt to the iWALK crutch. Below knee amputation. The patient must have at least 4 inches of residual limb behind the back of the knee. All of these other conditions present unique, individualized challenges and must be assessed on a case-by-case basis. Patients who pass the physical qualifications for use might still struggle to adapt due to psychological factors. If the patient exhibits extreme fear, is overly nervous, or unmotivated to use the iWALK, then adaptation is unlikely. Also, Type A personalities have a tendency to overthink the process, which can inhibit their body's ability to naturally adapt. The way to handle this type of patient is to distract them during the training process. While walking with them, engage them in conversation. Ask them about their job, family, hobbies, whatever, so that their mind is occupied in answering your questions, allowing their body to take over the job of adapting. This tactic can also work well for nervous or scared patients. Some patients do not want to take instruction or want to shortcut the training process. Don't let them. The fitter must control the training process at all times. You are the teacher, and they are the student. This relationship must be enforced to ensure their safety and success. If at any point in the training process the patient is really struggling and wants to stop or give up, It's best if you don't force them to continue. Often, just taking a few minutes for them to regroup and regain their composure is enough. But you also need to realize that sometimes, even people who meet all the physical qualifications simply cannot adapt. Fitting. People don't think about how to walk. They simply do it by recruiting the muscle memory they have developed over their lifetime. The iWALK becomes your patient's lower leg. So the closer you come to mimicking their normal leg geometry, the more they can recruit their existing muscle memory for walking. The height must be the same. The foot placement must be the same. And there must be a secure connection to make the crutch act as an integral extension of the patient's leg and eliminate all unintentional movement of the crutch. An experienced fitter can quickly achieve all these things, which makes the iWALK feel strangely familiar to the patient. This makes adaptation much easier. An incorrect fitting forces more gait adaptation, which makes it harder for the patient to learn. When properly fitted, qualified patients can quickly and safely adapt to the iWALK crutch. Proper fitting is essential, and it's easy if you follow our instructions. Prepping the patient. The patient should wear form-fitting pants that allow you to easily identify where the top of their leg is. Avoid baggy pants, shorts, or skirts. Empty their pockets of any belongings. Patients should wear comfortable athletic shoes or be barefoot. Avoid sandals, open-heeled shoes, or heels. Adjustments and settings. Since every human leg is different, the iWALK crutch has a variety of adjustments that will allow you to tailor it to your patient's specific leg size, shape, and alignment. In this section, you will learn how to use these adjustments to properly fit the iWALK crutch to your patient. Foot adjust for left or right leg use. Let's start with adjusting the foot for left or right leg use. Positioned properly, the arrow on the top of the foot will be pointing outward, away from the patient's injured leg. If the foot is positioned incorrectly, the arrow will be pointing inward, towards the patient's uninjured leg. Positioned incorrectly, the iWALK will be unstable, which could result in a fall and/or injury. Never fit your patient with incorrect foot orientation. To reorient the foot, remove the height adjustment C-clip. Rotate the foot 180 degrees, then reinsert the C-clip. Gait strap adjustment. If your iWALK crutch has the fabric gait strap, no adjustments are necessary. If your crutch came with the plastic gait strap, position the strap approximately 3 finger widths above the top of the knee platform. It can be repositioned later to optimize for the patient. Height adjustment, lower leg. When properly adjusted, the iWALK leg will be the same length as the good leg. To adjust the lower leg height, have the patient seated with their injured leg bent 90 degrees at the knee. Place the iWALK on the thigh of the patient so that the knee platform is pulled firmly against their shin. Have the patient hold the crutch in this position. Have the patient extend their good leg so that it's next to the iWALK. Proper adjustment will place the bottom of the patient's heel level with the bottom of the iWALK foot. Lengthen or shorten the lower leg height adjustment until you achieve the right setting. Then reinstall the C-clip and tighten the clamp nut and bolt. Test your setting by having the patient kneel on the crutch. Weight must be distributed evenly between the good leg and the iWALK leg. The patient's hips and shoulders should be level. If not, readjust the lower height adjustment. Height adjustment, upper leg. The height adjustment for the upper leg allows you to position the handle and thigh supports at the top of the thigh. Position it as high as possible without causing discomfort. The higher it is, the more stable the crutch will be. To adjust, make sure that the 2 thigh supports are at setting number 6. Then remove the 2 blue C-clips. Place the iWALK on the thigh of the patient so that the knee platform is pulled firmly against their shin. Then adjust so that the handle and thigh supports are as high as possible on the patient's leg. Remove the crutch from the patient's leg and push down slowly on the handle until the adjustment holes align. Then reinstall the blue C-clips. Thigh supports. The thigh support adjustment serves 2 different functions. One is to fit the patient's thigh circumference. The other is to compensate for valgus or varus conditions. This is done through an asymmetrical arrangement of the thigh supports. When you follow our fitting process, thigh circumference and valgus, varus conditions are adjusted for automatically. To start the process, have the patient kneel on the crutch, holding the handle. Their feet are positioned side by side, hip width apart. Their leg is firmly against the gait strap. and back of the handle is firmly against their thigh. Weight must be evenly distributed 50-50 between the good leg and the iWALK leg. The patient will instinctively place most of their weight on the good foot, so correct this as often as needed. With the patient's weight still distributed 50-50, grasp the tube and rotate the inner thigh support until it is in firm contact with the patient's inner thigh. Then lock in this setting by fully tightening the thumb screw. Check to see that the patient is still distributing their weight 50-50. Then rotate the outer thigh support until it comes into firm contact with the outer thigh. Then fully tighten the thumb screw. There should be no gaps between the patient's leg and the thigh supports or the back of the handle. Take note of the number settings. It's perfectly normal if the two sides do not match. This is how the iWALK accommodates for valgus or varus conditions. Straps. The strap system on the iWALK crutch is simple, but often used incorrectly, so please follow along carefully. All three straps are the same, except that the strap that goes behind the knee has a larger pad. The strap consists of two sides. One side has black webbing. The other has blue webbing. Although the two sections function similarly, they have very different purposes. The black section is typically a one-time adjustment used when first fitting the patient. The black section's only purpose is to adjust the length of the strap to fit the patient's leg. The blue section is used only when donning and doffing the crutch. You use it to fully tension the strap when putting the crutch on, and releasing the tension when taking the crutch off. The patient will tighten the blue section every time they put on the iWALK, and they will loosen the blue section whenever they take off the iWALK. In order for the iWALK to function properly and to provide the easiest patient adaptation, the straps need to be very tight. Properly tensioned straps prevent unintentional movement of the crutch. If the straps are too loose, the patient's control of the crutch is reduced, which can make the crutch feel unstable. Properly tensioned, the crutch becomes an integral part of the patient's leg, is easily controlled, and feels very stable. Now let's install the straps onto the crutch. First, remove the pads from the straps. You will reinstall them later. Fully extend the black webbing, then fully extend the blue webbing. Repeat for the other two straps. Install the black T-lock buckles onto the crutch. The black buckles go on the inside of the patient's leg. For right leg use, install the black buckle on the left side of the crutch. For left leg use, install on the right side. Adjusting the straps. Now we will adjust the length of the strap so that it fits the patient. Have the patient kneel on the crutch while holding onto the handle for stability. Make sure the patient is fully forward on the knee platform. Their leg should be firmly against the gate strap. Start with the knee strap. Kneel in front of the patient and bring the strap over the back of the knee. Then attach the blue buckle to the knee platform. Reaching behind the patient's knee, pull on the tail of the black webbing until the strap is snug. Then cinch it to full tension by pulling on the blue section. Then test to ensure it's fully tightened. If the strap is properly tensioned, it should be very difficult to slip your finger between the strap and the patient's leg. And it should be impossible to remove the blue buckle. And when properly tensioned, the gray buckle should be almost touching the blue buckle. If the buckles are too far apart, loosen the blue section. Then slightly lengthen the black section by lifting up on the gray buckle. Retighten the blue section and check your adjustment. Repeat the process until the strap length and tension are correct. If the buckles are almost touching, but the strap is still loose, loosen the blue section. Then slightly shorten the black section. Retighten the blue section and check your adjustment. Repeat the process until the strap length and tension are correct. Now, adjust and tighten the upper thigh strap. First, make sure there's no gap between the handle and the patient's leg. Then, bring the strap around the patient's leg and attach the blue buckle. A good trick to avoid getting too personal is to pull the strap downward while bringing through the patient's leg. Reach around with your other hand, grab the strap, and finish by fastening the blue buckle. Tighten the strap by pulling on the tail of the black webbing. Then, cinch the strap tight using the blue section. Check to make sure your adjustments are correct. Now, we will adjust the calf strap. Before we do, note that the preferred location is at the back of the knee platform. The strap mounts can be repositioned if the preferred position causes discomfort or interferes with a cast, boot, or brace. Adjust the calf strap the same way you adjusted the other two straps. Check the final tension. Now remove the crutch from the patient. Start by loosening the straps, then remove the blue buckles. Remove the crutch from the patient and install the 3 pads. The smaller pads with the logo go on the upper thigh and calf location. The larger pad goes on the knee strap. Before you install the pad, lengthen the black section by approximately ½ inch. Then install the pad. Wrap the pad as tightly as possible. Note that the Velcro strips attach to the fabric, not to each other. Casts and boots. The iWALK can be used with most casts or boots. Some may require some simple modifications. If you're using an air boot, make sure that the pump is located on the side of the boot. If located on the front of the boot, it will pump with each step on the iWALK. If you must use this type of boot, you will need to disable the pump mechanism. If there's a large step between the end of the cast or boot and the patient's leg, then the area above the cast or boot is unsupported when you kneel on the crutch. This results in the patient's weight being concentrated at the top of the cast or boot, which can result in a painful hot spot directly under the top of the cast or boot. Fortunately, this is easy to fix. Simply add additional padding to take up the space directly above the end of the cast or boot. A folded towel works great, or you can add additional padding from any source. If using a towel, make it thicker than you think it should be. It will compress when the patient puts weight on it. Teaching your patient to walk. Teaching your patient to walk is the most rewarding part of being a certified fitter. With proper fitting and instruction, most people who meet the qualifications for use can be quickly walking independently in confidence and safety. Before you start, let's go over some prerequisites. Pick a location with a hard, flat surface. Avoid carpet and uneven terrain. Choose an area that's free of obstacles that will allow the patient to take 10 or more steps without stopping. Make sure there's a wall, rail, counter, or similar that the patient can use if they need help balancing. The patient should have comfortable shoes with flat soles. Avoid open toes or open heels. Learning with bare feet is okay and often preferable to wearing shoes. Be patient and supportive. Some people adapt in minutes, others take longer. Most patients adapt quicker if the iWALK leg is slightly shorter than their good leg. Before you start, adjust the lower leg height adjustment down by 1 setting. After the patient has basic proficiency on the crutch, you will restore the equal leg length setting. Training exercises. Put the crutch back on the patient. Remain kneeling directly in front of the patient during these exercises. This prevents them from trying to walk prematurely and allows you to assist if they lose balance. Position them with their feet side by side, hip width apart, with weight distributed evenly on both legs. Before you get them walking, you're going to have them do a training exercise. This simple drill will give them a feel for the device and prepare them for walking on their own. Have the patient grasp the handle, then hold the crutch by the 2 upper tubes. Instruct the patient to put most of their weight on the iWALK leg, and to lean forward, and when it feels natural, take a step forward with their good leg. You can pull forward slightly on the crutch if the patient doesn't lean forward on their own. In order to initiate walking, the upper body has to advance so that it is in front of the iWALK foot. That means the patient must start leaning forward before they take a step. The step with their good foot will happen naturally. That's how we walk. Have the patient step back to the starting position, feet side by side, hip width apart. Then repeat the exercise as many times as it takes for the patient's motion to become fluid. Now repeat the drill, but let go of the crutch to allow the patient to do it on their own with no assistance from you. Continue the exercise until the patient has fluid movement. Next, have the patient step back a little further with their good foot so that their good foot is behind the iWALK foot, as it would be in normal walking. As before, have them lean forward and take a step with their good leg. Then return the good leg back to being positioned behind the iWALK leg. Repeat the exercise until the patient is proficient. Remember that your primary objective in these exercises is to get the patient to commit to getting their body mass forward of their foot before they initiate their step. This is what happens in normal walking. So when they do this, walking with the iWALK will feel familiar because it's much like normal walking. Common issues. Here's some common things to look for. Most patients will gradually shift their weight back to their good leg before they take a step. It's essential that all of their weight transitions to the iWALK leg before they take a step with their good leg. Looking down, in normal walking, the head is in column with the body. It's perfectly normal for your patient to look down. Every patient will do this, but this causes postural changes that make it more difficult for your patient to learn. Some patients will resist leaning forward. Some will even lean back. This is understandable. It can be scary to commit to their first step. It's essential that you correct this right away. If the body mass does not advance in front of the iWALK foot, then the patient can't walk. Plus, there's the risk of them falling backwards. If your patient does this, place your hand in front of their upper chest and instruct them to bring their upper body all the way to your hand before they initiate a step. When they do this, they will naturally step forward with their good foot. Repeat this exercise as many times as it takes in order for the patient to step fluidly. It's not uncommon for the patient to remain in an erect posture and merely poke their foot forward in a simulated step. The correction for this is the same. Place your hand in front of their upper chest and instruct them to lean forward and bring their upper body to your hand before they initiate a step. When they do this, they will naturally step forward with their good foot. Fatigue or mild soreness in the good leg, glutes, and lower back are not uncommon as new patients often over-recruit their good leg. These issues will typically self-resolve in the first couple days as the patient gains proficiency. If it persists, you can also try raising the lower leg height adjustment. Walking. When they have mastered these drills, it's time to let them walk. Position yourself beside and slightly behind the patient on the crutch side. Patient starts the same way they started the exercises. The first step is with their good leg, but this time they will continue walking. Once they start walking, don't stop. Continue for as many consecutive steps as space allows. Stopping and starting makes it harder to learn. Check the strap tension and retighten if necessary. If they are off balance or have a tendency to lean back, a gentle force on their upper back using only your fingertips is all that is needed. Avoid over-assisting them. This will slow down their learning. Even if their first steps are awkward, most patients will automatically adjust to smooth their gait. Continue practicing for a couple of minutes. When the patient becomes proficient, it's time for them to go hands-free. Have them let go of the handle and continue walking. Their arms should be at their sides, swinging naturally. Walking on the iWALK is very much like normal walking, but with minor gait adaptations. At some point, the patient's body will recognize this, and their gait will automatically adapt and become more fluid and efficient. As a fitter, your goal is to get the patient to this point. From here on, the patient will progress quickly. At this point, you will adjust the crutch to provide equal leg length. This will improve the efficiency of the crutch and promote more normal gait. Also, check the strap tension and retighten if necessary. Common issues. These are common mistakes that patients make while learning. Looking down. People don't look down when walking normally, but your patient will. Everybody does. You need to constantly monitor for this and correct it whenever it happens. The wedding march. This condition happens when the patient takes half steps with their good leg, so that their good foot lands side by side with the crutch foot. It looks like they are limping. It's easy to spot and easy to correct. Remind the patient to commit their full weight to the crutch when the good leg is in swing phase. You can also instruct them to imagine that they are pushing down on the crutch as hard as they can. Then lean forward and step through. Valgus or varus correction. When standing or walking, the entire width of the tread should be in full contact with the ground. Walking on the outer or the inner edge of the foot makes walking more difficult. This happens because the patient needs additional adjustment to compensate for valgus or varus leg geometry. Valgus or varus compensation is done by adjusting the thigh supports. To correct for valgus, which causes walking on the outside edge of the foot, first release the tension of the upper thigh strap. Note the number settings of the thigh supports. Loosen the thumb screw of the inner thigh support and decrease the number setting by 1. Then retighten the thumb screw. Next, adjust the outer thigh support by increasing the setting by 1. Then retension the strap. Observe the patient walking with the new settings. When correct, the crutch should be angled correctly and the tread is in full contact with the ground. Continue adjusting the thigh supports until you achieve this. To correct for varus, which causes walking on the inner edge of the tread, you do the same procedure as for valgus, except adjust the thigh supports in the opposite direction. The catwalk. Most people walk with their feet on either side of an imaginary center line. Some people walk with their feet on the center line or even over center line, much like a runway model walks. This results in the crutch angling inward and the patient walking on the outer edge of the foot. The solution is the same as for valgus correction. Release the tension of the upper thigh strap. Note the number settings of the thigh supports. Loosen the thumb screw of the inner thigh support and decrease the number setting by 1 or more. Then retighten the thumb screw. Repeat the process for the outer thigh support, but this time increase the setting by 1 or more. Then retension the strap. Repeat adjustments to the thigh supports until the crutch is angled correctly and the full width of the tread is in contact with the ground. Assistance from others. If your patient has a companion or caregiver who wants to assist, don't let them. Having an inexperienced person involved in the training process will only distract the patient and inhibit the learning process. Stubbing the eye toe. At some point, your patient is going to do what we refer to as stubbing their eye toe. This happens during swing phase of the iWALK leg, when you're bringing the iWALK leg from back to front and the front of the tread hits the ground. This can be pretty scary, but it rarely results in a fall because their good foot is planted firmly on the ground in front of them. A small stumble or hop is usually the worst thing that happens. This condition will typically self-resolve pretty quickly. Other skills. Now that you have your patient walking proficiently, it's time to teach them to handle these common everyday situations. Donning and doffing. The average patient will don and doff the iWALK 10 to 20 times per day, so let's teach them how. To remove the crutch, have the patient release the strap tension. Then remove the blue buckle. Start with the calf strap, then the upper thigh strap, and finally the knee strap. To don the crutch, have the patient kneel on the crutch. Make sure they are all the way forward. Next, fasten and tighten the knee strap, then the upper thigh strap, then the calf strap. The process may be slow this first time, but by the end of day 2, the patient can self-don and doff in about 10 to 15 seconds. Stairs. Stairs can be navigated easily and safely with the iWALK crutch. Training on stairs can be done as soon as your patient demonstrates proficiency at walking hands-free. When navigating stairs, it's essential that the patient always use the handrail. To go up, start with the good leg, then follow with the iWALK leg, placing the iWALK foot on the same tread, beside the good foot. Go one step at a time, then repeat. For descending stairs, the recommended method is to go backwards. Lead with the iWALK leg and follow with the good leg, placing it on the same tread beside the iWALK leg. Continue to descend one step at a time. Ensure that they always hold onto the handrail. An alternative method for descending has the patient facing forward. This method only works if the handrail is on the opposite side as the iWALK leg. Lead with the iWALK leg. Note that you cannot face straight down because the foot of the injured leg will hit the uphill tread. To keep this from happening, turn partially sideways, then proceed down with the iWALK leg. Follow with the good leg, going one step at a time. When walking up or down slopes, your patient uses the same technique as when navigating stairs.
Support.
As you do more fittings, you're certain to experience unique situations not covered in this training. At iWALKFree, we provide a dedicated staff to assist you, so feel free to contact us with any questions. Certification and video submission. Now that you've completed this course, it's time to get certified. Getting certified is simple. First, you take our online test, which consists of multiple choice questions based on this training. After each answer, you'll get immediate feedback to assist in your learning. You can take the test as often as you like, and there's no limit to how many of your staff can get certified. After taking the certification test, it is integral to put the theory into practice. In this step, you will demonstrate your proficiency in fitting and training someone to walk on the iWALK crutch. Here's how it works. When your student achieves basic proficiency, meaning they can walk unassisted and hands-free, you will take a video of them walking and send it to our technical support team for feedback. So that we can provide accurate and complete feedback, please follow our video submission instructions carefully. For your convenience, you can use your smartphone to record the video and upload it directly from your phone. Here are some essential elements. Please note, first fittings must be on uninjured people. Fitting actual injured patients or customers should not be attempted until certification is complete. Avoid dark clothing, as it blends in with the black iWALK crutch, making it difficult for our technicians to assess the relationship between the crutch and the user's leg. Position the camera so that we can see the user from head to foot for the duration of the video. Record them taking at least 5 steps towards the camera, then turn around and take at least 5 steps away from the camera. Also, please provide a picture of the thigh support settings as shown here. We need to see this perspective, so we can identify the numbered adjustment settings of the thigh supports. Note that the numbered settings don't need to be the same on each side. Once you're ready to submit, go to the iWALKFree website and in our menu click Doctors and Dealers, then our Certified Fitter program. Once there, scroll down to Step 3 to fill in your information and add your video. Submit videos of your fitting results, including the thigh support settings. You can upload directly from your smartphone using the upload portal on our website. You can also submit via your Mac or PC. An experienced iWALKFree technician will review your submission and provide feedback. After you have implemented our recommendations, you will take a new video and submit for further feedback. When our technicians are content that you have obtained the necessary skills to perform successful fittings, they will approve your status as an iWALK 3.0 certified fitter.